It's my great pleasure not only to introduce you as a friend, come on up, Ann. Ann Hartstein, who has been is our secretary, but someone who knows the needs of elders throughout, going to come and talk to us about all the great things that we can be doing statewide and take any questions that people may have. But we are so thrilled to have you there. Thank you for what you do for us day in and day out, and anything that you need from my office, obviously, we're here to help. Thanks.
Thank you. Good morning, everyone. How are you all doing this morning? Are you healthy? Yeah? The best news about something like this, an event like this, is you really get to find out what's available to help you stay healthy, to be healthy, and to have a great life. I do a lot of talking around the state, and I want to thank the representative for inviting me here today and for Linda for running such a great shop here. I do a lot of talks around the state, and people always say to me, people think old people are old. And I said, well, what does that mean? Well, when people say old, what do they mean? They mean sick, frail, disabled, incapable, right? All the things that none of you are demonstrating here today. People do have chronic illnesses as they grow older, and things do change in your body as you grow older. But old is not a bad thing. It's not a bad thing. But we don't really, in our society, recognize that. And do you know why that is? Because there's a thing called ageism. And ageism is the negative stereotypes that go along with something, myths that go along with something that society accepts without really even thinking about it. And your job today, and for the rest of your life, is to demonstrate that old does not mean sick and disabled and incapable. That those of us who are old can actually do a lot of things. We contribute to society. We learn how to take better care of ourselves. We choose whether we do or not take care of ourselves, better take care of ourselves. We make choices every day. And it's important to make sure that all of us pay attention to the fact that we are who we are. 60 is not the new 40, as they say. 60 is 60. And let's embrace it. Let's enjoy it. 80 is 80. And it doesn't mean that because you're 80 that you shouldn't be driving. Or because you're 80, you shouldn't be cooking for yourself. Or because you're 80, you shouldn't have flies flying around your head. Again, we need to change the stereotype of what it means to grow older. And I think that's one thing that we've been working on at the Executive Office of Elder Affairs for a long time. How many people do you know who have ever said, I'm not old enough to go to a senior center? Right? My mother used to say that when she was alive. And I would say, Mom, what do you think a senior center is? And she'd say, well, it's for old people. I said, no, it's a place to socialize with others. It's a place to get a good meal. It's a place to get information. It's a place to exercise. It's a place to share what you have to share. It's a place for you to volunteer. And she was like, oh, well, that's just like my synagogue that I go to. I said, that's right. It's a place to go that can help you meet other people, spend time with other people, have a chance to do what you want to do in a setting that supports what you want to do. So I can see that all of you know what a senior center is, what a council on aging does, and that you understand that. But what we need to do is spread the word. We need to spread the word among all people, both young and old. There is a study that was done by Yale University, and it demonstrated that people in their late 20s, if they had a positive attitude about aging, that in their lifetime they lived 7 years longer and were healthier at older ages. So we know that attitudes make a difference. You are healthier and you live longer if you have a positive attitude about aging that starts very young. So at the Executive Office of Elder Affairs, at the direction of Governor Patrick in 2010, we developed what is called the Aging Agenda. And I have copies of it here for you, which we can hand out. And the aging agenda has 9 principles for aging well. And those 9 principles impact all aspects of our lives. And it is based on the lifespan. When people hit 65, okay, aging doesn't just sneak up on us. You know, all of a sudden it's like, oh my God, I'm old. Well, when we're young, we like to think about getting older. When we're 4 or 5, we say, oh, I can't wait to be older so I can go to school or do what my older siblings do. When people are 15 or 16, they can't wait until they can be 16 or 17 so they can drive. When people are 20, they can't wait to be 21, and we know why that is, right? But for some reason, when people hit 65, all of a sudden, it's like, oh my God, I'm old. Things have changed. And there's not that much difference between someone who's 64 and 364 days old and those who are 65. You don't change that quickly. So the opportunity for us to really look at aging as a lifespan, with a lifespan perspective, we know that people who have health insurance when they're young, or access to quality health care when they're young, are less ill when they're older. That's one of the reasons why the Patrick administration has worked very hard to make sure that health insurance is available and quality health care is available for everyone from the earliest ages. Because we know that that makes a difference in people's lives. We know that if people have access to good education when they're younger, it allows them to get better jobs. And better jobs mean a better retirement or better economically secure older age later on. We know that. And that's what the aging agenda is all about. It's about making sure that we give everyone access to quality education, quality supports, jobs, good jobs that they can work in, that we give people who need access to assistance with their functional needs, people who need assistance in personal care, and all kinds of care that they might need at home have access to that as well. And that's not only for older people who have disabilities, it's also for younger people with disabilities. So we're working hard to make sure that we have a lifespan approach to aging, and we hope that you will join us in that effort. Councils on Aging are great places. I love them. We have lots of programs that operate out of Councils on Aging. Our SHINE program, serving the health information needs of everyone. Has everyone heard of SHINE program in Massachusetts? It's the program that provides assistance for people who are looking for what is the best health insurance for them to use. Now, October 15th, which was yesterday, is that right? And going through December, the beginning of December, is open enrollment for health choices. And what I say to people every year, you should check what your insurance is and if it's the best insurance for you. It's not about whether it's the best insurance for your spouse or your friend or your neighbor or your relative. It's what's best for you. The way Medicare works is that each individual has their own coverage. So you need to make sure that any coverage that you have meets your needs. If you evaluate that on an annual basis, you might find a better plan for you. You might find an option that works better for you. So make sure that if you have a chance, you make an appointment with the SHINE counselor over the next month and a half or so. There's many volunteer opportunities available. We have programs that run out of Elder Affairs that include visiting elders in nursing facilities to make sure that the residents' needs are being met. And we really appreciate the fact that we have so many volunteers who do that. So I will stop there and ask if you have any questions. We really are excited. I'm really excited about being here. I love the view. I know you all see it every day. It's a beautiful view, beautiful opportunity, and I love the fact that there's so many vendors here who are available to answer any of your questions. Make sure you take advantage of those. Do any of you have any questions for me? Comments? Yeah.
I know you've seen a lot of senior centers in the state, and how different and varied do you find the senior center community?
That's a great question. As we always say, if you've seen one council on aging, you've seen one council on aging. And that goes for senior centers. If you've seen one senior center, you've seen one senior center. The best news about senior centers is that they match the community in which they are. So it's the people in the community that get to decide what kind of senior center they have. And so the kind of senior center you have reflects who you are and what you want. We have had many, when I was in Needham, we were looking to build a new senior center because I said the same thing. I said, I'm the director in Needham and it reflects the community we have. And we had a senior center that was in the basement of a building. That doesn't really reflect what we think we should have. And I predicted that it would take 7 to 10 years to build a new senior center. Well, it took 25 years, but it's there now. In Needham, they have a new senior center. And what we know is that as soon as you build a new senior center, it fills up. It's already too small by the time you build it because so many people are so excited about coming to a new building, to a place that, again, meets their needs better, a place where they can socialize, a place where they can exercise, a place where they can just relax and read the newspaper if that's what they want to do, a place where they can buy gifts at the gift shop, all of those things. So senior centers are very different. Each community has to make some choices about what it is that what they want and what they do. And it's a process. But I've never known a community that built a senior center that was sad that they had done it. It improves the quality of the community. It improves the base for people moving into the community. So it's a great thing for parents to do. And again, if you've seen one, you've seen one. Other questions or comments? Good luck. Again, I want to thank you all for. You have questions? Okay. Oh, just shifting. Okay. I just want to say thank you all for listening today. I know there's a lot of good information out here that you want to look at. Again, I want to thank Jim for inviting me here today. It really does help to have legislators who care about the issues that you care about. Make sure that if you have concerns that you have that need to be taken care of at the state level, that you talk to people like me when I come to events like this, and that you talk to your legislators. I know you have regular office hours at the senior center. It's really important because when legislators hear things from you at any time about something that's important, it sticks in the back of their mind. And then when something comes up before them around that issue, they say, somebody said something to me about that, a year ago or 6 months ago or 3 years ago. And it sticks in their head. And they say, I should do this because that's what they told me they wanted. Don't assume that legislators can read your mind. They're not mind readers. They need you to tell them what is important to you. And they don't only need to hear from you at budget time, although that's a good time to talk to them. They also need to hear about you throughout the year, from you throughout the year, and you let them know what you think, what you want, and they can work on that. That's their job. Their job is to work for you. So make sure that you know your representatives, your senators, talk to them, and I would request that each of you commit over the next year to make at least one phone call or one contact with your legislator. Now you all who are right here can fulfill that requirement right here in person. Right. So go ahead, take advantage of it, and then I don't have to come back next year and ask you who did it, and don't raise your hand. It's really true. Meet the people who can make a difference, who can help you make a difference, and don't assume they can read your mind. So again, I want to thank you all so much. Thank Linda and the representative for inviting me here today, and for all of you for allowing me to see this beautiful view while I talk to you. And thank you so much.